Namaste.
Welcome, Dr. Sanjay.
Thank you very much, ma'am.
Namaskar, Dr. Sanjay. Welcome.
Thank you very much, sir.
संजय जी नमस्कार.
Namaskar, sir.
कैसे हो?
Sriji, please start.
Yes, sir. Okay. Good morning and namaste, everyone. Thank you so very much for joining this Sunday morning on our virtual speaker series on Ayurveda. Today is session 20th of our season 2. And the topic of today's discussion is pharmacological and therapeutic effect of Jatiyadi Ghrita. And we have a very special guest today, Professor Vaidya, Dr. Shantala Priyadarshini ji. A very warm welcome from Latvia. And we also have Professor Tatnia joining us from Latvia. Very, very warm welcome to you. And our expert speakers today, Dr. Sanjay Motilal ji, warm welcome ji. And Dr. Nilesh Doshi ji, and a very warm welcome, sir. Thank you so very much for joining. And
Namaskar, sir.
Namaskar. And it is our, I think, bi-weekly ritual that we get enlightened by our expert speakers on every other alternate Sunday, and we are grateful. And today, particularly, I want to specially thank sometime. We missed that Dr. Harish Verma ji and Dr. Madan Thangavellu ji, Dr. Pallavi Sodhi ji, and of course from US we have Dr. Ashilesha ji, who has been joining us from time to time, and also Dr. Bhaswati. Your passion, commitment for enlightening, the key benefits of Ayurveda is very, very important as we are trying to promote preventative health. So on behalf of Canada India Foundation and all the partnering organization, I want to especially thank you all for your commitment and unstinting support to this initiative. And we're looking forward to today's great presentation. And with that note, I would like to invite Dr. Harish Verma ji to start the session, begin the proceeding. Over to you, Dr. Verma ji.
Thank you, Sriji. Namaskar. Good morning, friends from Toronto, and welcome to 20th session of virtual lecture series on pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicines. Friends, we are running this virtual lecture series from Canada with the support of Canada India Foundation, Toronto, Consulate General of India in Toronto, American Association of Ayurvedic Professionals, USA, Ayurveda Union of Midwest, Chicago, Association of Ayurveda Academy, UK, European Ayurveda Association, Germany, International Ayurveda League, Mumbai, Tatha Astu, USA, and our media partners in Europe, UK, Canada, and US. Today, the topic is pharmacological and therapeutic effects of Jatayadi Ghrita or Jatayadi Ghrita. Jatayadi Ghrita is a traditional Ayurvedic medicine which is prepared by processing ghee with some herbal decoctions and fresh paste of herbs. Jatayadi Ghrita is used mainly for healing non-healing ulcers and internal bleeding ulcers. Jatayadi Ghrita was found very effective in some clinical trials for reducing burning sensation, pain, spasm, itching in patients of anal fissure, which is also called Parikartika in Ayurveda. Today we have two expert speakers, Dr. Sanjay Motilal Tamoli ji, who is PhD in Ayurveda, Dr. Tamoli is currently working as Director, Target Institute of Medical Education and Research, which is engaged in clinical research, product development, and regulatory services. Through Timer, which is Targeted Institute of Medical Research, he has conducted many clinical trials for all major Ayurvedic companies and government institutions. Today, Dr. Tamoli will enlighten us about the pharmacological benefits of Jatayadi Ghrita. And today we have another expert speaker, Dr. Nilesh Doshi, who is MD Shalya, which is MD Surgery in Ayurveda. Dr. Doshi is a recipient of Sushrita Award from Directorate of Ayurveda in Maharashtra. He is founder president of Association of Ayurvedic Practitioners. He presented exclusive work on pilonidal sinus and rectovaginal fistula in various national and international conferences. Welcome, sir. And our special guest today is Dr. T.R. Shantala Priyadarshini ji, who is also MS in Ayurveda and also MSc Technology. She is a Ayush chair in University of Latvia. We shall learn from her how traditional Ayurvedic medicines or traditional Ayurveda can be integrated with modern science and how people can be benefited of this integration. And we have Dr. Madan Thangaveluji with us. He's a genome scientist, and today he will moderate the technical session. So without wasting any time further, I invite Dr. Madan Thangaveluji to moderate the session. Welcome, sir.
Harish ji, namaskar. Satish ji, namaskar. Thank you for bringing us all together again using the power of technology, connecting the world. Shantala ji, thank you for joining us today. Tatania, thank you for joining us today from Latvia. We are connecting the world, Canada connecting with Latvia. I'm today here in Brussels, in Belgium, and with India, different parts of Bombay. To provide some continuity with our presentation, the last presentation, I just want to share a few slides and see how we can connect it with our event today. Now, last week, the last session, the 19th session, we heard about the big Congress that's coming in Toronto, the World Non-Communicable Disease Congress, the third World Non-Communicable Disease Congress. The details are at this website here. Now, the connection that I want to make between today's talk and non-communicable diseases is this about diabetes and non-healing wounds in diabetes. This is taken from a very recent paper with researchers at the Wound Healing and Regenerative Medicine Research Program at the University of Miami in Florida, the Miami School of Medicine, and shown, I want to focus on that one image here of normal wound healing on the left-hand side and non-healing diabetic wounds on the right-hand side. Now, when we look at diabetes, a lot of people suffer from this problem, and you can see on the abstract here, the estimates of the number of people who suffer from non-healing wounds that leads to complications, amputation, etc., etc. Now, when we look at this a little closer at this schematic here, you will see how the complex pathophysiology of a diabetic wound involves immune cells, neutrophils, macrophages, and fibroblasts. And the complicator in all this is the bacteria. The bacteria form what is called the bacterial biofilm, and that impairs wound healing. And this is approximately the rough sketch about how we get to non-healing wounds. We are very fortunate to have here today with us Tatania Traveska joining us from the Faculty of Medicine in the University of Latvia and Riga. And she has, along with authors, several authors have done a very detailed study of the antibacterial and anti-inflammatory potential of this formulation in chronic wound healing. So I'm going to stop here and invite Tatania to take over very quickly to highlight what she has achieved in her study. And if Titania is not here with us, I request Shantalaji. Oh, okay. Titania is here. Thank you, Titania.
Just coming back. Yeah, thank you so much for inviting me. So I tried to go without video. I'm sorry, because I'm in a children's hospital with my kid, and the internet is lacking sometimes. So yeah, and if it stops, please tell me. Yeah, it's my pleasure and it's my honor to talk today about our interdisciplinary studies on the Ayurvedic herbal formulation. And yeah, as you know, I represent University of Latvia. And the overall idea, and I think the great effort was made to bring Ayurveda as an ancient Indian medicine together with biomedical science to involve our knowledge in medicine, biology, chemistry, and physics. And the project I will tell about is about interdisciplinary collaboration. So, and we also involved a term which is could be Ayurvedic biology. So something connecting the ancient science and modern science using modern techniques of exploration. And here we had the collaboration project between University of Latvia and Aryavadya Pharmacy. And the most important person here from Aryavadya Pharmacy was Dr. Somit Kumar from Coimbatore, and it was also represented by AVP Research Foundation. So the project itself started from 2016, and it was around for 2 years. And you might see the name of the project. And the main goals or the goals of the project was to create or develop reverse pharmacology approach and systematic research on Jatayadi Thailam. So here we talk about Thailam as the sesame formulation in vitro, so in laboratory. And we were focused on antimicrobial, anti-inflammatory, and also tissue granulation stimulating activity, the process of healing, and the healing of, and sorry, I should say, so the healing of diabetic foot, yeah, which is one of non-healing ulcers, and it creates a lot of problem. That's why Jatayadi Thailam was chosen for this research. And I will not talk a lot about reverse pharmacology, but I can talk about antimicrobial part, which is my field of expertise. And as additional goals, we had the modification of existing Ayurvedic product for the purpose of studies. And we had actually studied extracts, hexane, ethanolic extracts of the ready Ayurvedic product. And the primary goal also was to create a novel product on the basis of this ancient created formula. And here you might see the building in the academic center of Tornekans in Riga. So it looks nice in night lights. And the left side shows our technicians and our PhD student, Baivas Andersona, in the lab. So this center was opened in 2015. So it was almost immediately elaborated in the project. So here we do teaching of students, and we do also research work. And so why we wanted to study this product, all of us are aware about the antimicrobial resistance problem all over the world, and due to increasing use of antibiotics, we are now rapidly approaching the end of antibiotic era. So we would like to learn more and to go for new ways and find new antimicrobial approach. And additional aim would be that new antimicrobial agents would not create resistance in bacteria. And so we had actually two Ayurvedic products which are named Jatayadi Ghrita, and one of them was based on an Ayurvedic formulation of India, and it's a reference AFI, as you know, 2nd edition. So you all are experts in that, and you can see the formula on the left side. So it has also one mineral component, the copper sulfate or tuta, which was not added in the experimental formulation, which was created in India by the Dr. Somit Kumar group, because the copper sulfate itself also has this antimicrobial effect. Yeah, so, and you can see the Sanskrit formula below. And on the right side, you can see the Jatayadi Ghrita as per Ayurveda pharmacy, because this formula is slightly different. Yeah, and still it contains jasminum, flaxseed, glycyrrhizal glabra, licorice, curcuma, nigella, and so on. So we had these two forms in sesame oil. But it was very difficult to study the sesame oil formulation. As in microbiology, we usually do with diffusing agents such as antibiotics, or we do with liquids, and we had oil. So one of the ideas was to make this lamellar gel, like a special suspension, which would be then applicable for further studies. And you can, see the Dr. Somit making these emulsions. And then we had antibacterial testing in vitro. We tested both ready formula as an oil, and we have tested the extracts. It was a crude extracts of all this, like all herbs in the formula. So both like AFI formulation and AVP formulation. And then secondly, we had anti-inflammatory properties and tissue granulation studies where you used mostly extracts. So where we couldn't use the Thailand itself. And I will shortly go through the methods. So it's traditional, or like say conventional methods used in microbiology. It's an agar dilution method and the broth microdilution method. And we used both reference strains with the numbers, which can be represented in each reference laboratory, or the studies could be repeated. And we had also clinical strains from diabetes mellitus patients, and we had people with actually clinical signs of diabetic foot. And first of all, we wanted to study which bacteria are mainly involved in diabetic foot, non-healing ulcer, and this study shows the most representative agents. So, and as you might see, this is Staphylococcus aureus, and Staphylococcus aureus in 39%. It's quite high numbers. And to add more, these are sequence-based studies. So they are quite precise. They are studies where not many people involved, but we can see this. We can identify the species with much precise. Okay, so Staphylococcus was followed by Anaerococcus, which are anaerobic, and they're usually not grown in laboratory. So what we usually grow in laboratory, this is, from the patients, it's usually Staphylococcus. And to add more, Staphylococcus aureus is able to make biofilms. And another bacteria would be Staphylococcus epidermidis, and then we have E. coli. So staphylococci might make biofilms, and then this type of wound would be much more difficult to heal with antibiotic approach. And to add more about the data we had for diabetic food, we have here the data on, first of all, if it's a gram-positive bacteria, so it would be in the red box. And for example, you can see France, Spain, Portugal, yeah, some European countries where actually prevalence is high, where it's mostly gram-positive bacteria, means usually it's Staphylococcus. And then more in detail, we have Staphylococcus aureus, which could be about 30% up to 50%. So this shows that it's the main player in the game. And additionally, we can see MRSA prevalence, or that is methicillin-resistant Staphylococcus aureus, which is non-responding to most of common antibiotics. And then we have also India here, which is interesting. So we see it as a green box, and all those green boxes shows bacteria, the regions or the countries where gram-negative bacteria are predominant. So gram-positives will be less than 50%, but still, if we go for India, we see that gram-positive bacteria, staphylococci, would be isolated from 38% of people. And the percentage of methicillin-resistant Staphylococcus aureus is about 46, which is also high. Okay, so that means we should see the treatment which is effective for staphylococci, but we should not forget about other bacteria. We also wanted to know the picture in Latvia. So which bacteria do we have usually in diabetic food? And here we have a short study, which was run by Cynthia Sausha. She's also expert in Ayurveda, and she's doctor in endocrinology, and Daiga Kalniņa. And here we had a collection of 95 patients, and this was a retrospective study. So what did we found that in 50% of our patients, we had gram-positive bacteria, which means Staphylococcus aureus, Streptococcus, Enterococcus, Staphylococcus, and the rest was represented by gram-negative bacteria, such as E. coli, Klebsiella, Proteus, Pseudomonas. So still Staph aureus is the main player. Now we will come to the results, and the first results were based on agar dilution method, and here we had little bit difficulties actually because we had to intercalate like Jatayadi Thailand in the agar plate. So this agar plate was made with a standard Müller-Hinton agar, and then somehow we had to melt quickly Jatayadi Thailand and to add this into agar, and then we had to inoculate bacteria. In this case, it's Staphylococcus aureus, and then we should grow overnight. So first and second plate shows the agar with Jatayadi Thailand incorporated, sorry, I should say correctly. And then the third plate is a positive control. So without Jatayadi Thailand, this shows the growth of bacteria. So each spot represents one colony forming unit, and this is standardized. So we should be able to calculate this bacteria. And in the first and second plate, we see the bacteriostatic effect. Means after 24 hours, bacteria were not growing. So they stop growing, but we are not sure that they are killed. And when we did the research for both oils from AVP company and from AFI formulation, what we have observed that mostly these oils show the bacteriostatic effect for gram-positive bacteria. Yeah, so here we can see on the right side is gram-positive, and interestingly, it showed also the good effect of stopping growth of Staphylococcus epidermidis. So this is a reference strain which is biofilm producing, so biofilm plus RP62, and it's also important player. And it was also active for one gram-negative bacteria, which is Pseudomonas aeruginosa, which is also known sometimes to be common in hospital, to be involved in hospital infections, hospital-acquired infections. And this was the only bacteria from gram-negative rods which was showing effect on it. But some other bacteria, so gram-negative bacteria, there was no growth inhibition. So this was like the problem. And we also have tested multi-drug resistant Pseudomonas aeruginosa. We have tested MRAP, Acinetobacter baumannii, which is also quite bad boy, we say. Yes, so it's also much resistant. Unfortunately, no efficacy. And if we want to do conclusions, we could see this bacteriostatic effect was unsusceptible and methicillin resistant Staphylococcus aureus, which was very good, actually. But the bacteriostatic effect was observed for gram-positive bacteria, Enterococcus, Staphylococcus, and for gram-negative, only drug-susceptible Pseudomonas aeruginosa. The next part of our study was about the extracts. So we had the extracts, and this is a crude extract, so it means the whole formula was there, except copper sulfate. No tuta was added, and it was isolated and so extracted according to the standards by Dr. Subhashini from Avinash Lingam University, Coimbatore. And we have received in Latvia so-called non-polar and polar fractions. And you might see those small bottles, yeah, so of the extracts. And then we put these extracts in the microplate plate, and here we applied the method, which is broth microdilution method. And we did a serial dilution. So you might see the extracts diluted from the left side to the right side. So each time it's serial dilution, it's diluted by twice, and bacteria were also added, and growth medium was added. So the next day we observed the efficacy of the extract, and we saw whether bacteria grows or not. And in this method, we also could determine the minimal inhibitory concentration of the extract, which was still acting, had bactericidal effect on bacteria. And if you see the control of growth, it's just here below. So we can see the bacteria without, in the last two lines, you can see bacteria which are growing without presence of any extract. Okay, and just to show quickly the results, what we could see that there was a different efficacy of different extracts. And we, of course, paid more attention to Staphylococcus aureus, which is methicillin resistant. And we did each experiment in triple. So here we might see in this red circle, so AVP polar extract, and the minimal inhibitory concentration was about 31.2 milligram per ml. So no growth still. And for AVP non-polar would be hexane extract, the minimal inhibitory concentration was even lower. So the lower numbers here means the better efficacy, actually. And in parallel, we applied this method with using so-called resozurin stain. And this resozurin stain is very good because we could see either bacteria are living or they are killed by this extract. And if they're still viable, they would be in pink. And if they are killed, they appear in blue. So this shows us additional effect and gives us some additional result. So here I wanted to show them and to summarize the results of this part of the study. So with the Bros microdilution method, we could show that again, the ethanolic, crude extract from AVP, I should say, so AVP should be the left row and A5 should be the right. They both had efficacy. Yeah, so minimal inhibitory concentration was even better, so it was lower, but it was better for the AVP. But both had some effect on bacteria. And again, we had this inhibition effect on gram-positive bacteria, but we didn't saw efficacy for gram-negative bacteria. So no inhibition or very high numbers means there is almost no effect. And this table would summarize all data. And this is shown in the publication, which Professor Madan Tangavalu mentioned. I just conclude shortly that both ethanolic and hexane extracts were active against all the tested gram-positive bacteria causing diabetic foot infection, and both reference and clinical strains of methicillin-sensitive Staphylococcus aureus and for reference methicillin-resistant Staphylococcus aureus. And AVP, ethanolic, and hexane extracts showed a little bit more activity in vitro than A5 ethanolic hexane extracts. And here I want to show our team. So as you might see, it's very nice international collaboration. And from the left side starting, it's Dr. in biology Ilona Mandrika, who did anti-inflammatory studies, and she worked in tissue granulation. Then, I'm sorry, it's me, myself. Then we have a doctor in medicine, Iveta Liduma, and next will be my doctoral student, Baiba Andersson. And then we have Professor Valdis Pirjoks, who is the head of LU Indic Studies Institute, and then Dr. Somet Kumar from AVP Research Foundation. He was a great initiator of this project and had very nice ideas always to share. Then we have Dr. Cynthia Sauja here on the right side, and Professor Shizupov and Dr. Sujit Eranizal from AVP India. So he visited us and stayed for several months doing Bros microdilution method. And we are also grateful to other people, including Hari Sauj from AVP Baltics. And we have a surgeon, Professor Arnold Yazupov, who deal in his everyday practice with diabetic foot patients. So he helped us with collection of diabetic foot clinical samples. Yeah, and here it is a study. If you want to learn more, you can go for the publication, so you can see the DOI number here. And I want to thank you for attention, and if any questions, please.
Tatiana, thank you so much for being with us today. To save on time, we will quickly move on to our next speaker. Please stay with us so that we can take questions at the end of the sessions, and also some comments at the end of the two other presentations from Professor Shantala Priyadarshini. I want to welcome our expert speaker here, Dr. Sanjay Motilal Tamoli, joining us from Mumbai. Sanjay ji, namaskar. Tatiana, could you, if you stop sharing your screen, then we'll be able to continue. Thank you for being with us. Please stay with us because there might be a few questions as we progress. Sanjay ji, namaskar.
Namaskar, sir.
You have seen here, the point I want to emphasize here is how we can blend Ayurveda with contemporary science and microbiology. And we want to see some of those, many more of those things happening. Sanjay ji, perhaps you will guide us into this thinking because.
Yes, I'll just share my screen.
Keep in mind, we will be swift as we go through the presentation. So if there are things you want to be brief about, please be, so that we can get to the discussion and get some valuable.
My screen is visible, I hope.
Perfectly fine, sir. Thank you so much, Sanjay ji. All yours.
Thank you very much, sir. And first of all, let me thank the organization for giving this opportunity to share my views and my experience, more specifically with Jatiyadi Ghrita and Jatiyadi Taila. To start with, my primary focus and my over the years, that experience that I have driven is more towards use of various Ayurvedic formulations, be it tablets, capsules, and all everything. And very recently, we have been extensively working on Jatyadi Taila and Jatiyadi Ghrita. To start with this particular paper, I think many of you must have gone through this paper because it was published some time back, and this was one of the best innovations, I would say, in using various traditional Ayurvedic formulations. I'm not sharing the complete paper, but you can always have a look at that later on. So this particular study was done on Jatyadi Taila, and the most important thing was we converted this Taila into a ready to use form, in the form of aerosols, so that anybody who does not wish to touch the wound, basically, more specifically in burns kind of wound and all. So in order to make the product more hygienic, more sterile, and easy to use, this product was converted into this Jatyadi Taila was converted into an aerosol spray, and we use this in diabetic foot ulcers and varicose ulcers, which are basically chronic non-healing wounds. This was a randomized controlled trial where this particular study was done against the conventional treatment methods that are used, be it betadine kind of formulations and the various different other methods that are currently used. So and the results of this particular study were fascinating in terms of the effect that Jatyadi Taila was able to show, as good as the currently used practice of using various oils and various conventional treatments like betadine, etc. are concerned. So I'll be able to share this paper with you, and you can also have a look at it online. Coming back to the main topic today. So this whole concept of Jatyadi Taila or Jatiyadi Ghrita, before we understand that, let us go back a bit and try to understand this Sneha Kalpana in Ayurveda. It's a very, very unique kind of delivery mechanism. And what fascinates us as scientists working in this field and people who are into research is the wisdom 5,000 years plus back, that the understanding of using vehicles, be it water, be it alcohol, be it oils, etc. How to deliver this goodness of herbs through this different medias, that was so very well known to those old saints and scientists of that time. That's what really is amazing to understand. And Sneha Kalpana or the lipid say media is one such fantastic kalpana that we have. So these snehas were used in the form of 4 different primary medias. One of them was oils, then ghee, then vasa, and majja. These were basically meant for delivering of active herbal ingredients. These were unique formulations because they involved not only processing with lipid methods, but also it was a multiple phase kind of extraction technique that were used. One of them, the first step rather, is water extraction, thereafter lipid extraction, and at times in many of the formulations, like say for example a Mahanarayan Tail, which is very commonly used in Ayurveda practice, is milk extraction as well, which we call it as the Kshir Paka in Ayurveda. Now, like one more beauty about these products was they were used not only for the purpose of external application, they were used equally for internal administration also, along with different panchakarma procedures that we all follow, be it basti, be it abhyanga, or any other shirodhara, etc. So, so all in all, the application of these sneha kalpanas, or these oils and ghees, what we call it as, it was so wide and so expanded that right from external application on wounds to internal administration on ulcers, these were extensively used. So that was the third point that I wanted to emphasize. The other thing which is distinct in Ayurveda is one of the methods of processing, or I would say rather a pre-step of processing is to do murshana. Now the word murshana as such means to remove the impurities and make the oil as safe and potent as possible. Now in those good old days, oil extraction or oil preparation was done by a different method altogether, and therefore there were chances, or there were possibilities of a lot of impurities coming into the oil. There were chances of the oil being allergic. There are chances of the oil being reactive to the body, and therefore this murshana sanskar was used, where the oils and the ghees were primarily processed with certain herbs like Daru Haridra, which is Berberis aristata, or Triphala, or Manjishta. Now the purpose of doing this murchana was to remove the toxins, number one, enhance the efficacy of the product, and make the product more stable in terms of enhancing its shelf life. So this was the fourth point that I wanted to emphasize over here. And the last very important thing is that while til taila was generally used for oil preparation, we have also in the Ayurveda science seen all different other types of oils also being used, as the last speaker talked about was on different methods how oils could be prepared. So coconut oil or maybe mustard oil, etc., were also extensively used. So with this background on Sneha Kalpana in Ayurveda, we'll go to the topic today in terms of Jatiyadi, and why Ghrita as a media is supposed to be a good media in terms of using these herbs and actives and all. So we find that Ghrita is used for the purpose of extraction of all those fat soluble actives into the formulation. It improves the therapeutic value of herbs. It enhances the shelf life, improves the absorption of actives, and last, most important, when it comes to internal administration, it makes the preparation more palatable. Now, this is something which is more critical or more important when it comes to Jatyadi. The word over here, if you see, Sanskar Anuvartan. Now, this is a beautiful these are beautiful two words in Ayurveda, which explains many things, in fact. And the literal meaning of this is that Ghrita or ghee has the potential of taking the properties of herbs into it without leaving its own inherent properties. This is what the Ghrita beauty is all about. And the second very important thing is ghee is one of those very congenial kind of kind of media or formulations to our body right from our birth. So we have different sanskaras that we all know right from our birth in our tradition or in Ayurveda. They are being recommended, and the sanskar and the like say administration of ghee along with gold, etc., is very, very popular and very effective. That is what we all know about it. Now, when we try to like say compare ghee and taila, there's always a debate and always a question in front of us. We as Ayurveda physicians and Ayurveda researchers would know that they have very distinct properties in terms of how they will be having their effect on our body. So we try to differentiate between these two properties, and that is what will make us more understanding in terms of when Dr. Nilesh sir would introduce you to the use of Jatiyadi Taila and Ghrita, more specifically into what stage of wound and what type of wound. Therefore, it is very important for us to understand over here that why Ghrita and why Taila. So Ghrita and Taila, if we see in terms of their properties, one of the distinct properties is the guna and the virya of Ghrita versus Taila. Now, when I'm talking about Taila, I'm very specifically discussing til taila, which is like usually the oil used. But if you are using a different oil, maybe coconut, then this property may be the same. And there are papers being published on this. So Shita guna in terms of Ghrita and Ushna guna in terms of Taila is what makes the product very distinct when you want to use it. So when you are using Ghrita, it is more predominantly a Pitta Shamak property, whereas in Taila, when we use it's more of a Vata predominant like pacifying property that we call it as. Therefore, when you are using Ghrita in clinical application, be it piles, fissure, fistula, etc., or any other wound for that matter, it will be more useful when you have inflammatory conditions associated with burning. And here you will have more utility of the product when there are inflammatory conditions associated with pain, because pain is primarily attributed towards Vata, and burning is attributed more towards Pitta. It's a basic philosophy. Then the same thing comes in terms of chronic wounds as well. When you have a Pitta predominant kind of wound, chronic wound, you can it's more recommended to use a Ghrita formulation. While when it is a Vata Kapha kind of predominant wound, we can make use of Taila formulation. While scrolling some of the research papers, we came across a very interesting finding when it comes to immunomodulation effect. Now, we all know in Ayurveda, we all know about herbs being immunomodulators. Now, the beauty when we say immunomodulator is it can be either a formulation or a herb which can actually help you suppress the overactive immune response. So Ghrita will be more effective when it comes to over responsive kind of like say conditions, just as we had the very recent condition of COVID. So Ghrita would be more useful in those kind of areas, while Vata would be more of a stimulant where you require immunostimulant activity, and therefore we collectively call these two formulations as immunomodulators. So wherever you need immunosuppression to be done with its anti-inflammatory property, it's better to use Ghrita, while when you require a stimulant kind of property, it's better to use Taila formulation. Now these two findings have been published also with respect to certain preparations, like more specifically I would say is Guduchi along with Ghrita and Guduchi along with Taila. Guduchi is all of us know that it's one of the best immunomodulators, but when it is given along with Ghrita, it becomes more of a suppressant. When it's given in Taila, it becomes more of a stimulant. So that's the beauty of the media that we need to understand over here. Last, it's very important that the action of these formulations, be it Ghrita or be it Taila, would all depend upon the ingredients along with which they are processed. So if we are processing them against ingredients which have specific properties, like say for example, Yashtimadu kind of formulations, it will be more Pitta more Pitta balancing. While if we subject it along with herbs like Trikatu, it can be more Ushna, and therefore will be used in more of a Kapha kind of conditions. So this is the basic difference between Ghrita and Taila. We need to understand this in respect to Jatiyadi Taila and Jatiyadi Ghrita as well. Now going to the ingredient profiling of Jatiyadi Ghrita as such. So I've taken the reference over here. There are different references. We have taken a reference over here from Ashtang Hridaya, Uttarstan, where Jatiyadi Ghrita formulation has been detailed out. So Jati is the main ingredient, is the first ingredient, and therefore the product is called as Jatyadi. Adi is etc. for the understanding of those who are non-Ayurveda. So it's Jati etc. Ghrita. So like there are many herbs along with Jati. So jasmine is one of the major or the first ingredient for that matter. All the other ingredients are in equal proportion. I'll not read them out individually, but I'll just give you a glimpse on an idea of this kind of combination. So all these ingredients that we see, be it neem, be it Berberis aristata, or your Daru Haridra, or Kurkuma longa, that's turmeric, or Manjishta, they are all Rakta Prasadan Dravyas. They have a property of doing purification of or like say they have a property of purifying the blood, and therefore the utility of Jatyadi is more relevant in Dushta kind of Vranas, or the chronic wounds that we are talking about. So the Rakta Prasadan activity is very, very critical when it comes to the usage of Jatyadi Taila or Jatyadi Ghrita for that matter. It's absolutely wonderful. Every single ingredient that you see, be it neem, katuka, darvi, nisha, etc., everything that you see, they are all Rakta Prasadan Dravyas, and therefore this particular formulation, be it internal, be it external, would be absolutely useful in chronic non-healing wounds, and that's what we have seen in clinical evidence as well. The other important ingredients, one of the two major important ingredients, one is Tutta, that is copper sulfate. The previous speaker already spoke about it, the relevance of it. Now, we have found out in our studies that copper sulfate as such, or copper sulfate in Jatyadi Taila, they have got wonderful angiogenetic properties, and therefore that's what makes them more useful in areas of wounds which have lost the circulation, or which have lost the vasculature basically, and therefore this particular ingredient is very, very critical to Jatyadi Taila as such. And the last one is definitely Madhu, which where honey is, it's not honey as such being used, it's more of a wax from honey that is used in this particular formulation. Now, the method of preparation of Jatyadi is very unique. Unlike making kadhas or decoctions, that's water extract, the herbs are taken in the form of paste, and I'm talking more specifically about this particular reference. The herbs are taken in the form of paste. The paste is prepared, and then it is added to Ghrita and digested till the point that all the water in the paste gets evaporated, and then Tutta and the other ingredients are added so that the Ghrita is finally prepared. Now, modern research on Jatyadi Taila and Ghrita have already proven many pharmacologically activities. One couple of them I have listed over here, which are more relevant in terms of our topic for today. The anti-inflammatory activity, the antimicrobial activity, which Madam already discussed about it, the immunomodulatory activity. What I'm interested more in this angiogenetic activity, which is absolutely fantastic. Even Jati has got even licorice, which is Glycyrrhiza glabra, has got angiogenetic activity, which helps in the formation of new vessels, improves the local vasculature, and therefore heals the non-healing chronic ulcers that we are talking about today. This is one of the other papers which I would like to emphasize over here, for the reason that wherever possible, we try to use Jatyadi Ghrita as a formulation. But a wonderful research was published in a good journal, where Jatyadi Ghrita was compared against Jatyadi Taila prepared in coconut oil. Rather than preparing it into till oil or sesame oil, it was prepared in coconut oil. So Ker Taila is coconut oil basically, where it was found out that Jatyadi Ghrita and Jatyadi taila prepared in coconut oil have comparative effects. And therefore, the conclusion from this particular study and in our clinical evidence also, we have found out that where we are not able to use Jatiyadi Ghrita or non-availability or whatever it may be, because we're talking about a global perspective, it can also be used as Jatiyadi coconut oil as well. And in fact, I would say we can go beyond this and understand that Jatiyadi the ingredients that we saw can be processed in different types of oil medias. But what we need to understand only is the basic properties in terms of the Rasavirya, Vipaka and the Gunas in the Ayurveda point of view, and from the modern point of view, their anti-inflammatory activity. And also lastly, from the clinical aspect or the clinical usage point of view, where we will be understanding its anti-inflammatory properties and antimicrobial proproperties also. So this is all about this is all about Jatiyadi Taila and Ghrita. Thank you very much.
Thank you so much for taking us into the heart of certain issues, like the difference between Tailas and Ghritas. And you did that very nicely. I think many people have been asking this question. We started off also wanting to be curious to learn a little more, and you've given us a very good overview here. Thank you again for putting this slide up to us. Please wait with us. We'll move on quickly to our next speaker, and then perhaps there'll be some questions as we go along. As I keep mentioning it at the start of each of our events, these are only tasters. They're here just to show people, just to give a brief introduction to people about how Ayurveda has different formulations, how they're used for hundreds, thousands of years sometimes, and how they continue to be beneficial. Sanjay, thank you so much. We now quickly move on to our second expert speaker. Delighted to have here with us Nilesh ji. Nilesh ji, namaskar ji. Thank you so much for joining us today. Namaste. The floor is yours, ji.
Yeah. Thank you so much, sir. First of all, at the outset, let me thank all of you for inviting me to share my views on this particular topic. Sir, as being a surgeon and being an ano-rectal surgeon, use of Jatiyadi tail is very, very extensive in our practice. But here we are talking of Ghrita. So when tail is useful and when Ghrita is useful is very important to know. And that's what we are, I will focus on. I will not go much into the details. All of you are aware that basically we are using this tail or Ghrita for Vran, and the definition and what Susruti says that Vranayatiti Vranaha Runoti Yasmat Rupdeapi Vranvastuna Nasyati Ade Dharnat Yasmat Vran iti Uchate Buddhe. Means the things, once the wound is created and the scar which does not go is called Vran. That is what the basic philosophy of Vran. And normally it has been mentioned that it is Sadhyo Vran Agantuj or ulcer, that is niche. These are the two basic difference of or types of the Vran. So when we talk about tail and Ghrita in proctology, predominantly we use this tail or Ghrita in anal fissure, fistula in ano, and pyloral sinus. Fissure, as all of you are aware, it's an elongated ulcer in the long axis of the lower anal canal. Mainly it is at the midline posteriorly, but many a times it is it happens at anteriorly also. Young and middle-aged also, and in children the things is, and equally it is happening in both males and females. The sharp, how does it happen? Fissure. So sharp curve of posterior wall of rectum from sacrum and anal. You see, previously we were used to be four legs things. And since we have started walking in erect position, the anatomical structure has little bit changed, and there is a sharp curvature from rectum to anal canal. That is one of the major causative factors, as the all ano-rectal disorders, predominantly fissure and all, are happening into the human beings and not in the animals. The another important factors are constipation, and straining is the most important causative factor. Even the laxative taking person suddenly passes hard stool, then also it causes the problem. Spasm of sphincter makes it chronic, secondary or to post-anal surgery. Proctocolitis and Crohn's disease are also equally, is also responsible for causation of the disease. This is usually happening into the midline, the posteriorly. Anterior is common in women. 10% female is suffers from the anterior, whereas only 1% male is having anterior fissure. Deep fissures, when it becomes very chronic, and if we keep on straining, then the deep fissures occurs, and that it goes up to the internal sphincter, and then it causes the spasm. And it also causes the skin tags, hypertrophied papillae, abscess or fistula too. The common symptoms are pain, that is sharp cutting, tearing, burning, bleeding, swelling, discharge, and pruritus, that is itching. And urinary symptoms also happens like dysuria, retention, frequency, etc. So I'm just giving you the brief of these diseases just to understand that how it happens and how the treatment usually useful. So normally in treating the fissure, I treat primarily with only two things. One is the laxative, and another is the Jatiyadi Tel Basti, that is 4 ml per rectal twice a day for 21 days. That is very useful, and it heals the fissures. All acute fissures gets healed within 21 days of this Jatyadi Tel application. And if it doesn't happen, then Susruta has said Samvruta Vibhrutayat, that is the concept of anal stretching, which has been described in the management of fissure. Next is the fistula in ano. As all of you are aware, fistula in ano is a tract lined by granulation tissue which opens deeply in the anal canal or rectum and superficially on the skin around the anus. These are the various types. I am not going into the details of these. These are blind external and blind internal. Again, from modern point of view, that is high anal, low anal, and all intersphincteric, transsphincteric, and supralevator. Why I'm giving more stress on this sphincter, because the importance of Ayurvedic management in fistula in ano is primarily is more, or all across the world people uses for the transsphincteric and supralevator fistula in ano. The causes are previous pyogenic abscesses, fish bone, egg cells, blood-borne infection, etc. But at the same time, certain diseases are also causing the fistula in ano, like tuberculosis, Crohn's disease, CA rectum, or now previous ano-rectal or gynecological surgeries. Now pelvic, now it's a trend that pelvic floor disorders and the colorectal things are going hands in hand, and both the events and conferences are taking using each other's speciality. In fistulae, it's a seropulmonal discharge, swelling in the perianal region, and fever. These are the common features. The treatment is laying open of the tract, Sharsutra application, partial fistulectomy with Citon, partial fistulectomy with Sharsutra application. Now, while treating the fistula in ano, what we feel that there is a failure of wound healing and delayed wound healing. These are the two biggest challenges what all the colorectal surgeons are facing. And even in all the cases, when we use Jatyadi tail, still the wound doesn't heal, or it takes longer duration. So at that time, if we try with betadine ointment, mupirocin, enzymic CM, that is collagen, and various types of the tule, still it doesn't heal. Now what to do at that particular time? So at that point of time, we use Jatiyadi Ghrita. And as you are saying that this patient was operated on 9th of February, and this is the picture of 10th of February, was having a very large multiple fistula right from the base of the scrotum to the anal canal. On 16/2, you are seeing that the wound has started little bit of contraction and is, clear. On 28/4, that is, say about after almost 2.5 months, the wound is still as it is. And during these periods, we have used Jatyadi tail. When it doesn't help, we have used mupirocin ointment. Then we have used collagen. Still, it was not healing. And in that case, we started using Jatyadi Ghrita. And as you are seeing that on 7th of May, the size of the wound was much bigger, and on 10th of June, that is after a month, it was almost healed, and after 10 days, that is 20th of June, the wound was completely healed. So in such a situation, this type of the many cases we have treated, I am not showing all the pictures and would not like to bore you, but this is what one example I have shown you, that when all the things are getting failure, Jatayadi Ghrita has worked. And as you see, or we can say that as Sanjay Bhai has said previously, that this is probably one type of the Dushtavrana with Pittadikya, and tail was not working, and at that point of time, Ghrita has worked and done wonder in healing of the wound. Next is the pyloral sinus. It is basically a nest of the hair collection at the natal region, and that is how as it's a foreign body, it causes the disease that is known as pyloral sinus. Predominantly it is in the males, and is happening before the age of 20 years. It is rare in Negroes. It is more in dark, hairy, and obese types of the people. Also occurs in blonde and relatively hairless type of the people. Riding in bumpy, areas is also one of the causative factors. Normal sites are post-anal roll, anococcygeal region, and that is approximately 5 centimeters above the anus. Why I'm showing this? That this is a very important thing, that this is in the midline. And in midline, what problems we are facing in healing of the wound, that I will show you. Other sites are finger web, barber, axilla, perineum, umbilicus, and suprapubic region. At all these places also, the spinal sinus happens. That is, these are the symptoms, that is abscess, burst or opened by the doctor, discharges, seizes, and then it creates the multiple openings. This is how the hairs penetrates the natal region, and it creates the pyloral sinus. And the treatment, as all of you are aware, the complete excision of the sinus, primary suturing, jet plasty, these all are the treatment has been described in modern science. From Ayurvedic point of view, it is of 8 types, and laying open of the tract and Kshat Sutra, these are the 2 treatment which has been mentioned by Susuta. Now again, as I said, that this is the disease which is happening into the midline. And in midline, the wound healing is the biggest problem. And that's how, at present, almost 12 other procedures have been devised for the palmar sinus surgery. And to heal this midline wound, as I have said in the past, this girl was also given all the parameters like Jatiyadi tail and Mupiracin and all. Still, the wound was not healing. And once we have started Jatayadi Ghrita, you can say this is a very recent case. On 10th of March, the pit was like this, and on 28th of March, the wound has almost healed. So, this is how we use Jatiyadi Ghrita in various ano-rectal conditions. My previous 2 speakers have made my things very easy. I'm going to show you 2-3 research work which has been published. That is Dushtvran by Jatayadi Ghrita, treatment of Dushtvran by Jatayadi Ghrita. An international study for patients with Dushtvran and management by Jatayadi Ghrita concluded that it was significant therapeutic benefits for various subjects parameters, that is pain, burning sensation, itching, as well as objective parameters like size of ulcer, discharge, foul smell, granulation tissue, sloughing in management of Dushtavrana. This is what has been published. This paper was published in 2016, and as Sanjay Bhai said, that in cases of the Dushtavrana, Jatayadi Ghrita gives an excellent result over the tail. An experimental study on rats was done, and wound healing, and in that wound healing properties of Jatayadi Ghrita, and in an experimental model, a comparative research was done by full thickness excision model for evaluation of role of Jatayadi Ghrita in wound healing in Wistar rats by inducing diabetes. The result of the study suggests that Jatayadi Ghrita does not have significant effect on wound contraction when compared to Mupiracin hydrochloride. However, it does offer significant advantages in reepithelialization, fast maturation of granulation tissue, lesser inflammatory cells, and early angiogenesis. As Sanjay Bhai said, that the most important thing is the angiogenesis in wound healing. And in case of Jatayadi Ghrita, this has been proven that it provides a good angiogenesis effect. And this study was done here only in India by Dr. Jamdagni and all. And
Nilesh, could
yeah,
and
the last study already Madam has presented, so I will not go into the detail of this study what Madam Lady
thank you,
Latvia has presented. No, so it gives an excellent result. Yeah. So over Jatayadi tail and Ghrita, both are equally important, but somewhere the tail is giving better results and somewhere the Ghrita is giving better results. That's what from my end. Thank you. Thank you, Wes.
Nilesh, thank you so much for stopping, for taking us through these fine details, particularly the case studies, and very convincing that in a very short period, in less than 3 weeks, you could get such fantastic results for non-healing wounds. There is something here about copper and the role of copper. I think Titania had shown us why they excluded copper from the formulation, but you are two of you are saying copper is a very important part. And there's a lot of evidence in contemporary biology of the role of copper in wound healing. This is just one paper that I want to highlight here before we quickly go on to the question and answer session. The mechanism of where copper works, copper is required for activation of the hypoxia-inducible factor, but it's a very slightly complicated process in that if you have too much copper, it gives you a different effect. And if you have too little copper, then it triggers another effect. There are some clinical trials going on. This is one study on the effect of copper on healing of obstetric wounds. And we know that there are a large number of situations where you generate wounds, a cesarean section, or you have post-section wound problems. They all will benefit greatly from this intervention, the use of this. Our platform is open for questions and answers. I want to see if I can bring in Shantalaji here very quickly. Shantalaji, namaskar. And the question is about the interface that needs to be developed between Ayurveda as understood in the traditional way and aspects of modern biology. From what we are seeing, there is immense scope for interaction and dialogue. And you are our Ayush chair at the University of Latvia in Riga. And you, Titania has given us already an excellent example, and from the surgeons and the colleagues in Bombay, we hear so much. Please guide us. Particularly, your model in Riga is a model that we might want to follow in Toronto, establishing an Ayush chair, and details of this kind are very important.
At present, I would like to start my presentation, but before that, I would like to congratulate the platform for bringing such experts. And I was very happy to see the expert presentations. All the three presentations were extremely good. And that is one way of doing things. And I would like to put in some inputs for this. Jatiyadi Ghrita we have been using in autoimmune conditions in the oral cavity. And for example, like lupus who have oral problems. And then we have had pemphigus vulgaris, oral carcinoma. There also we have used Jatiyadi Ghrita. So healing becomes faster. So Ghrita, when we are putting it onto the mucous membrane, the results are faster. So, but we have always used Tutta in that. But when we did it for eye application, we saw that we didn't add Tutta because we were not very sure whether it was purified well. But if that is added, then no recurrence of conjunctivitis. Repeated allergic conjunctivitis, we have been using application of Jatayadi Ghrita with and without the Tutta. So it is very important that we realize that we should use Tutta, but it should be purified and then it could be added. So coming to my experiences in Latvia, can I please share my presentation?
Please do, Shantalaji. Tatiana, the question about copper in this formulation, I think there is a lot of discussion still to be had. We will take this forward in further discussions with all our colleagues here, but the Tutta and the use of, and when Shantalaji says pure, how do you define purity? I think all these are questions that we will take up into. Shantalaji, are you able to share your screen?
Yes, you are able to see it?
No, we
No,
cannot. There's a problem.
We cannot see it.
I go back and then come.
So
In the meanwhile, if there are questions
So-
while Shantalaji is working with trying to get her screen to us.
Am I available? Am I seen?
Not yet. We
No,
can't see
your
your
screen.
screen.
Seen? No?
No. Tatiana, the question to you too is the same. Your experiences in Latvia and how you see the interface between Ayurveda and modern science, and also the clinical evidence that is being offered. I know you're not a clinician, but tell us a little bit the clinical acceptance of this formulation. Tatiana?
Dr.
Yeah.
Madanji?
Should
Shantala
I
is
tell
having-
now?
Yeah, please, while we wait for
Yeah.
Shantalaji.
Dr. Madanji?
I would just interfere, take the
see,
opportunity.
I see very good
thank Dr.
connection.
Madan. Dr. Madan, can I
Shantalaji,
intervene,
please.
please?
please.
Yeah, so Dr. Nilesh Doshi is traveling, and in between he has taken the efforts to join us.
I think my
And would like to leave. He has to travel almost about 50 miles. So thank you very much, Nilesh ji, for breaking your journey and joining. Happy journey, and you can continue. We'll give you the expert comments and feedback. We'll update you.
Thank you,
Thank you
Nilesh ji.
so much, Bala. Yeah, I hope that I have justified the subject. And thank you so much to all of you for inviting me to share my views.
It was an excellent presentation, Dr. Nilesh. Thank you so much.
Dr. Nilesh, before you go, please tell us what is the role of copper sulfate in Jatayadi Telam or Ghritam? Is it added because of antiseptic action, or is it added due to cause chemical cauterization in the wounds?
It can be from both the way.
Okay.
It can be from both ways.
Nilesh ji, we would like very much to have you back in a separate discussion on this very important point, so that we can take this discussion forward, the copper sulfate story, the Tutta story. Thank you, Ji, once again for being with us. Shantala ji, your screen is now visible.
Thank you. Thank you. So at the outset, I would like to thank the platform for giving me this unique and great opportunity. And I would be thanking everybody on the platform. So first is the Canada group, which has been doing marvelous work of bringing youngsters into understanding Ayurveda importance and all that. And University of Latvia for having me here, and Ministry of Ayush for deputing me to create awareness in Ayurveda. So when I was posted to Riga, I had never heard of the word Riga. I had only heard about Rig Veda. So I was surprised that I am here. And then I will go into why Riga and Rig Veda am I connecting. See, swastika is very popular even in Riga. Everywhere we see that it has been probably in between, it was disturbed because of some political issues like Hitler's swastika, but swasti. We always speak about swasta, prasanna atma indriya manaha, as every Ayurveda person knows. So here also, this symbol means auspicious and good luck. So when we look at what is happening all over the world with swastika, you find marvelous reporting of swastika here all over the globe. Probably even in Canada, you will be finding it. And what are the global footprints from Veda was what I saw, because Baltic nations are very closely connected to Sanskrit, and global footprints I was seeing about the god thunder, Indra. The name Indra is very popular even now. The rector and the vice rector and all of them also have a name like that. So we have names and gods who are very much from the Vedic literature. As you can see, the Ashwini Kumaras, And here also we have Lakshmi Saraswati. So it is not just that. Then when I went to the National Library of Latvia, I was impressed because they have UNESCO Memory of World Records here, and it is what we see here as, you can see the slide. One compartment is ensured, 70% of the 70 compartments are there in that. And this was the person who did it. And he is the only person on the currency of Latvia. They have rewarded him. They still remember him. One road in Riga is named after him. So he has been awarded. And what are these Latvian songs? The Latvia Dianas. Dianas are like what the life story tells about ancient people in the Baltic states. So Baltic states will be all the three nations very linked up together with mythology, the pagan rituals, festivals, so many things. Then what are the treasures of Ayurveda is you can find huge treasures in Latvia also, because I look at everything with the Ayurvedic eyes. So we have ambergris, the amber here. So this has latest research that we found was that they found ambers and which have 50 million year old fossil on the of a flower, Asian flower. And we see that insects, everything that are fossilized in ambers speak a lot about history. And then we have buckwheat, we have honey, we have huge things, and the ocean well. We have huge things that we could be looking at for Ayurveda. Here is the first day when I went to University of Latvia. I met with the rector and the professors of the university. And then here is the class. The youngsters are very much interested to learn a lot about Ayush. And here it was the day when WHO representative had come for this Latvian Congress of Physicians. This happens once in 5 years. And I was an invited speaker. So when I went there and I spoke about individuality of treating conditions, not like what the present day research speaks about. Because 5 years have been identified by NIH to be working on whole medicine, whole body medicine, that is whole person medicine. What Ayurveda has been saying since centuries, now NIH also has started speaking of the same language. It wants to look at a person as a whole. So this was a congress wherein integrative treatment, global development and opportunities in Latvia was the session that I was speaking about. And it was a very good, it was an eye-opener. It was good for me to go and speak there, representing Ayurveda, representing India. So that is it. And then I met a lot of people whom I made contacts with. So that was one good thing. Then we had Erasmus programs wherein from European nations, I had to interact with 5 countries, and not only interact, we did give them classes on Ayurveda and yoga. So you can see that it was a very good thing to understand what is common in these 5 European nations and what is common in Ayurveda, or rather what is common in India. Then I not only report to Ministry of Ayush, I also report and get guidance from His Excellency, the Ambassador. He is very proactive, he is very supportive. And so also my other friends, Dr. Madan Tangaveluji, we have very good guidance from him. He says it is not like you have to come out of the comfort zone. The culture is different, language is different. You have to represent Ayurveda, you have to do a lot of work. So everybody is giving me guidance and support, and that was a very good thing. Then I had the opportunity to visit a lot of museums to understand myself, understand what is happening in Latvia. So it was a very good museum. I have been visiting all the museums here so that we know how Ayurveda can also be made into a virtual museum so that it can go global faster. So this has been published, and we have been speaking about how to. There is an institute who is also working on heritage of Ayurveda. So that could be a very good opening. We can have virtual museums and it will be easier. Then Ayurveda Day, again, we had speakers from many continents, almost, except Africa. I think we had all other continents, speakers from there. And it was a very good opportunity for me to find out what is happening about Ayurveda in that part of the globe. From Australia, from Singapore, from different countries of Europe, we had speakers, and we also had speakers like Minister of Ayush, Secretary Ayush, DG CCRAs. So it was a very
Shantalaji,
good experience for me.
Shantalaji, I'm going to interrupt here because we are running out of time now. There is a question
Yes.
here, and I request, thank you so much for sharing what you, very briefly, a quick overview of what is happening in Latvia. I would request our chair, Satish Thakurji, to join us. Satishji, namaskar. Satishji has a question
Namaskar.
about what we need to do. Shantalaji, if you are able to stop sharing screen share.
Shantalaji, can you stop sharing your screen, please?
And Satishji,
thank
namaskar.
Namaskar, Madanji. Thank you so very much. Such a wonderful presentation, and I was completely mesmerized with the overall. I think Tatnia gave an excellent presentation. I think that's what we are looking for, basically, that how with the modern medicine and the way of evidence-based research, and some of these products can be promoted that way. And I'll come to Tatnia a little bit more, but prior to that, our chair of Ayush at Latvia University, we would like to know a little bit more about how this initiative started and what are the processes and how long is the term and overall scope of work. So we are also trying here in Canada to have an Ayush chair established in one of the university. So that will help us, guide us to take it forward.
Oh, yes, I think it's a very good opportunity if Canada can get one. We had, it is like we had a agreement with the University of Latvia. And before I could join, there was one more chair who had come here. So the chair is also accepted from University of the particular university, and Government of India will be deputing after seeing what are the points that what are the things that the Ayush chair could be giving. So first is to create awareness about Ayurveda. Second is to create research opportunities, make research possible. And then the third one is also to bring in all the people together for Yoga Day, Ayurveda Day, and all that. So the selection of Ayush chair is not easy. You have to find out if you are making papers, you are presenting papers, you are presenting talks globally. And there are many points wherein you will be selected based on all that. And then that will be sent to the university concerned, and they too should approve. They will send 3 of the selected people. And there the university also selects that, yes, this person should be suitable for us. And then we join. This is usually for 1 year. And then if you do work which is conducive, or rather accepted by the university and the Ministry of Ayush, the second year is approved. It is actually for 3 years.
3 years, okay. And good to know. Thank you so very much. And Tatnia, the product which you Jatyadi Tela, like, is it now available in the market in Latvia? Is it being promoted more of a, daily use, I would say, ointment, you can say so, or is it still under the development process?
As I know, it is available. It is available in Latvia. Yeah, we have it from AVP as a ready formulation. Yeah, so it can be used. And as I know, Professor Valdis Piraks and Dr. Cynthia Sausha, they have approved the project, which is about the clinical research of diabetic foot patients with the using of Ayurvedic medicine. So probably they will also involve this Jatayadi Thailand as a part of this study. So this would be wonderful, So.
And is it manufactured in Europe itself, in Latvia, or still being imported from India?
No, it's not manufactured in Latvia. They import from India. It's import from India. And what I wanted to emphasize that in our study, we didn't add this tuta. So we had this formulation made in India for research purpose. The two formulations which I showed, the AVP, as per Yoga Granta, and the AFI. And in this, we didn't add copper sulfate. But when we tested copper sulfate, it has also very strong antimicrobial action. So we wanted to show the effect of herbal part. Yeah, that's why. But I think both work synergically. So it's very important. Yeah.
And how it is being perceived among the medical fraternity, people who are dealing with diabetic patients, like, is it taken very positively, or it's still in its on trial stage? What's your experience on that?
Me, myself, I wasn't involved in the clinical research on using Jatayadi. I think it's a way to go. It's still a way to go. The way to go, because it can be approved probably, well, as a food supplement or top ointment, but it's difficult, when you want to register as a medicine.
Excellent. No, your presentation is very helpful, Dr. Madan. As you know, and NCD diabetes is one of the key topic area. I think we'll pass along this information completely to Dr. Arun Chokalingam, and I think this will be very helpful for their partners. Yeah, thank you.
Satishji, thank you so much for asking those key questions. Shantalaji has much more information. Also, Tatania has more information. We will try and come together in a separate meeting so that we have a little more time, respecting the time that's given to us. We are almost 10 minutes past the 90-minute window that we were given. I thank everybody here, and Pallaviji, thank you so much.
Thank you, Dr. Madan. So when we are talking about Jatyadi Tailam and Ghritam, Jati is chameli. It's jasmine. It's got a very beautiful fragrance, and it's very stimulating. So we've come to the final end of the session. Thank you very much, all of you, with seeking Lord Dhanvantari's blessings. On behalf of International Ayurvedic League India, I thank our special guest, Dr. Tatiana and Professor T.R. Shantala, for their special appearance, and their information which you all shared today was tremendous. My special thanks to Dr. Sanjay Thamboli and Dr. Nilesh Doshi for being our expert speakers on the dais today, and to Canada India Foundation, immense and a big thank you to Mr. Satish Thakurji for supporting these webinars wholeheartedly, and making your presence felt in every webinar. That's great. And thank you very much, Consulate General of India in Toronto, Canada, Canadian College of Ayurveda and Yoga, Our collaborators, Canadian Ayurvedic Practitioners Association from America, from Canada, American Association of Ayurvedic Professionals from America. Sincere thanks to European Ayurveda Association, Association of Ayurvedic Academy, and Ayurveda Union of Midwest Chicago. It's real sincere thanks to all of the collaborators, and Tathastu, who technologically who support these webinars, Y Media, Pravasi Television. Without their support, we will not be able to carry on. And of course, thanks to the audience, and my special thanks to Satish ji, Dr. Harish Verma ji, Madan ji for doing such excellent moderation. And last but not the least, our audience. And I would like to inform our next webinar will be on 16th April, and the topic will be Anutel. Thank you. Have a good day and a great Sunday. Thank you all. See you next week.